We're presented with a 70-year-old man who had chest tightness and shortness of breath despite having had heart surgery and being on 15 medications. What should you do when traditional medications fail? So tell us about this 70-year-old man with good cardiac symptoms and a whole list of other health problems.
So he has high blood pressure, diabetes, chronic kidney disease, and he had the atrial fibrillation that was treated with surgery. He was also on 15 medications, but despite this, he had shortness of breath with mild activities. He still had chest tightness. He was feeling very discouraged because his quality of life was so poor.
So patients like this on the surface appear to be quite complex. There's a number of medical diagnoses: heart disease, diabetes, atrial fibrillation, and you can tell by the fact he's on 15 medications that his previous treatment was very piecemeal. However, when we evaluate someone like this, we really put all of these diseases under one umbrella. And these diseases fall under, essentially, biochemical imbalance and physiological imbalance. The primary source is nutritional imbalance, but there are other factors that may be involved. So our approach to this patient is one where we analyze his overall health condition at the cellular level first, and then our treatment would be an approach to target that first. So what was the initial evaluation?
So his left heart catheterization showed no major blockages in the large arteries of the heart. The ultrasound showed his heart pumping was mildly reduced. And even though we didn't see blockage in the large arteries, we know this patient had what we call small vessel disease, where the tiny blood vessels in the heart get damaged by the high blood pressure, the high blood sugar, and the poor foods that people eat over the course of their lifetime. Up to 40% of people with diabetes will get this small vessel disease. Then his blood work also showed some abnormalities. His kidneys were functioning less than half of what is normal. His thyroid was underfunctioning and his inflammation was really high. And we also know that those with diabetes are high risk of chronic kidney disease, and 30% of them will get chronic kidney disease.
Wow. You know, quite interesting findings, and interesting that you point out the small vessel disease. Oftentimes individuals will see a cardiologist and they have an angiogram finding like this, and they'll be told that the coronaries are fine, but the coronaries are not fine. Small vessel disease can be very lethal, as it can lead to progressive heart failure and the overall shortening of lifespan. So this individual has pretty advanced heart disease along with a number of other problems. So what was our approach with this patient with all of these complex health problems?
So we met with the culinary team and prescribed him a specific nutritional plan consisting of plant-based foods. And as he made progress on the nutrition, we were able to reduce the medications. We also added targeted micronutrient supplementation, for example, iodine to support thyroid function, cellular metabolism, and immunity, and we put him on magnesium, which helps carry out chemical reactions and protects against arrhythmias.
Quite impressive. You know, it's very interesting that you mentioned targeted supplementation, because oftentimes individuals just sort of take supplements randomly. And our approach is one where we evaluate the patient. We get extensive blood work, including micronutrient testing. We look for certain deficiencies, and compared to those deficiencies along with clinical concerns, we'll certainly target certain nutrients so that we can help the patient get into balance faster. Sometimes we will help with absorption of nutrients with a probiotic. So targeted supplementation, I think, is really important as opposed to random blind supplementation. So how did he do?
He did great. His chest pain and his shortness of breath went away, and he lost 32 pounds in only 2 months. He was controlling his high blood pressure, cholesterol, and diabetes on less medications. His thyroid function improved significantly with the iodine. His kidney function went up by 30%.
Oh, wow.
His inflammation went down by 85%. Important molecule we checked called lipoprotein A that increases risk of heart attack and stroke went down by 46%.
Quite impressive. So the medication reduction from 15 medications to 2 is what I'm very impressed with, because it underscores 2 things. One, the 15 medications were not contributing to the patient's well-being, and 2, the 15 medications were very likely contributing to the patient's illness. And so by reducing medications, I think that's part of the therapy. So it's amazing how someone can turn around these many illnesses in such a short period of time with a very defined, aggressive lifestyle intervention. And so it only goes to show you that the body can heal itself when properly nourished and put in balance. So I hope you got a lot out of this. As usual, if you have questions, comments, put them in the comment box and we'll get to them as soon as we can. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.